Okay, good day. My name is Fred. I'm going to explain to you a little bit about the CARF model that we have. We see a lot of care organizations that have problems with the administrative burden, the administrative load. And in order to help them address this in a structural way, we designed the Continuous Administration Reduction Framework, the CARF model. Actually, the CARF model is consisting of 5 different phases, and I would like to go through all those 5 different phases for you. But at first, it's really important that the organization knows what is their mission, their strategy, and their objectives, so that they know why are they reducing the administrative burden. If you don't have that clear, then it's really hard to work with the CARF model. The first phase of the CARF model is called the analysis and diagnosis phase. Imagine that your organization is like a patient. If you want to treat a patient, you need, of course, to understand first what is wrong, what is the issue. And to do that, you don't immediately jump to conclusions. What you want to do first is to define some measurements on which you decide whether or not this patient has a certain issue. In healthcare, usually these are called the vital measurements or the vital function of the patients, like the blood pressure, the heart rate, the temperature, etc. The same way in the CARF model in the first phase, we will define the most important things we want to measure. That can be the lead time between a request and answering the request. Or it could also be the time users spend behind their computer to actually administrate the forms. In the first phase, we, using some lean and agile techniques, help the organization to really identify what are the main items to address and to diagnose the core of the problem. In the second phase of the CARF model, we're going to look at all those parameters that we've diagnosed, and we're going to see what we need to do with the processes. How do we need to optimize them, or maybe in some cases, how do we want to redesign them? If we are optimizing processes, we're mainly looking at tuning existing processes and making them more effective and more efficient. For instance, when there is an intake process for a new patient, we're looking how we can make it faster or more qualitative or more reliable. When we're looking at the redesign of processes, we're really reconsidering existing processes. So for instance, in the case of an intake, maybe the intake can be done digitally instead of face-to-face. Or maybe we can develop an app to help the patient to prepare for the intake, and this way reduce the time that is needed to perform the intake. So the first phase of CARF is about analyze and diagnose the problem. The second phase is about optimize and redesign the processes. In the third phase of the CARF model, we're going to look at the digital solutions that can help us in optimizing and in redesigning the processes. Just as I explained before, for instance, when we have an intake process and we want a digital form that the client or the patient himself can fill in, then in this phase we're going to look at what digital solution will best fit this need. That could be a dedicated app that is very focused on delivering this task, but it might also be more innovative solutions like an AI interface that allows the patient or the client to actually talk to the app instead of entering data, and have an audio dialogue with an AI assistant in order to prepare for the intake meeting. In this way, there are many digital solutions that we as Qubiz Healthcare can suggest and can also implement where needed to be able to deliver that improvement in the processes so that we can reduce actually the administrative load that's involved. The fourth phase of the CARF model is about implementing, monitoring and supporting the digital solutions that have been designed or have been rebuilt. When you think about the digital solutions, they aim to reduce the administrative load. However, administrative load is not reduced when there is a developed product. No, the organization actually really needs to work with it well. They need to understand how it works, and they need to sustain working with the solution. In order to do that, in the CARF model, we have in the fourth phase the monitoring and support phase. That means that we are actually monitoring how are the digital solutions being used, if they are reducing the administrative burden that in the parameters that we set in the first phase are the ones we want to reduce, and we give feedback on how we can improve that. If we take again the example of the intake process, then when we move the intake process partly to the client or to the patient, our expectation is that the process will be less for the organization, because the patient or the client already has done a lot of work for filling in forms before you have the intake meeting. But maybe in reality that doesn't work out that way, because patients don't understand it or the information is not properly processed by the employee. This means we have to always monitoring and to make sure that we reach the objectives that we have set up front to reduce that process and make it more efficient. So the monitoring and support phase will help us not only see if it's used, but also to see if the app is used the way we intended to. And last but not least, we have the fifth phase in the CARF method. This is the continuous improvement phase. In this phase, we're not only looking at the monitoring and support of the digital solutions, but we are looking at new opportunities that arise because we are using these apps in a new way. And one example is that while the intake turns out that patients actually really like the way of dialoguing with an AI assistant in a voice way, instead of having to type in the forms, we might consider to introduce that same idea at other places in the process. For instance, for an evaluation or for an outflow phase in the process. So the continuous improvement phase is all about looking for new opportunities to continue reducing the administrative load, so that we can do that in the long run and not just on a short shot. So Qubiz Healthcare is about helping you to reduce your administrative burden not once, but for a lifetime.